Hi everyone, welcome back to your channel I Love Pharmacology, and in this session let us understand atropine. Do you know the pharmacological effects of atropine? Do you know where atropine is used clinically, and are you able to identify the adverse effects of atropine? So if the answer is no for these three questions, you should watch this video completely. So let's welcome to atropine uses adverse effects and pharmacological effects in this session. So these are the objectives that you are going to learn. That is the mechanism of action, clinical uses, and the adverse effects. So atropine acts on CNS. It has got stimulant action and it has got anti-Parkinsonian effect. On the CVS at lower doses, it produces bradycardia, but majority of the times atropine is used at a therapeutic doses which leads to increase in the heart rate, that is it causes tachycardia. So high doses can cause facial flushing as well as it can lead to reduction in the blood pressure, that is hypotension. So from the CVS part, you need to remember atropine causes tachycardia and hypotension. So what about the gland? Atropine effect on gland is to decrease the secretions. As you know that atropine is an antimuscarinic agent which block the activity of the M3 receptors which are present in the glandular cells. Thereby, stimulation of M3 will going to increase the secretion, whereas atropine will going to block the M3 receptors, thereby it decreases the secretory function. What about on the eye? So eye, it produces passive mydriasis, that is dilatation of the pupil, as well as it causes cycloplegia, where there will be loss of accommodation. So what is the effect on the smooth muscle? So on the GAT, it decreases the tone and motility, and simultaneously it increases the sphincter tone. So which collectively leads to decrease in the motility, leading to constipation. So what is the effect on the urinary bladder? So on the urinary bladder, so one should remember that it relaxes the retrosor muscle. Once it relaxes the retrosor muscle, and also it will going to increase the sphincter tone, there will be urinary retention. What is the effect of the bronchus? So usually on the bronchial smooth muscles, it will going to cause relaxation. So it will cause relaxation of the bronchial smooth muscle, thereby it helps in the easy breathing, and also simultaneously it decreases the secretion in the bronchial tree. So from these pharmacological effects, let us understand what are the applications of atropine. So this can be used in case of treating siluria, where there is a condition associated with increased salivation. So in such cases, you can give atropine. Atropine reduces the secretion. So in urinary disorders, this can be used because in case of urinary incontinence, this is a very important drug which will going to overcome the urgency, etc. Ophthalmic use, it can be used for dilatation, especially the atropine is used in case of the children's because of their ciliary muscle tone is very high. But atropine should never be used in case of adults because the loss of accommodation and dilatation will remain for 7 days, and the patient will have a blurred vision for almost 7 days, which is not acceptable. And it has got antispasmodic action. It can be used in COPD as well as asthma, as a pre-anesthetic agent, as a vagolytic agent, in case of poisoning, and in case of Parkinsonism. So, especially in case of urinary bladder disorders like overactive bladder, we use sulfasalazine, oxybutynin, flavoxate, and tolterodine. So basically, it reduces the bladder spasm as well as it helps in overcoming urinary urgency or urge urinary incontinence because it relaxes the detrusor muscle and increases the sphincter tone. So antispasmodic effect are very useful in case of irritable bowel syndrome, which reduces the pain and colicky sensation. And here we use iosine and the dicyclomine. Whereas in the COPD, we use these drugs in the form of inhalation. Example are the ipratropium bromide and thiotropium bromide. So pre-anesthetic agent, why they are used? The reason being preoperative use is to reduce the secretions in the airway. We use glycopyrrolate. Whereas in poisoning, atropine is a drug of choice for treatment of organophosphate compound poisoning, as well as atropine is an antidote of choice in case of physostigmine overdose. So Parkinsonism, atropine is used to treat the drug-induced Parkinsonism. Here we use benztropine and trioxyphenidil. And also we have one more use, that is it can be used in motion sickness. We use scopolamine as a transdermal patches. So coming to the adverse effect of the atropine. So usually one adverse effect you can expect is overdose of this drug can cause atropine poisoning. So what is the antidote for atropine poisoning? Antidote for atropine poisoning is physostigmine. So CNS, it can cause excitement, restlessness, delirium and hallucination. On the CVS, it causes tachycardia, palpitation and hypotension. GIT, it causes dry mouth, constipation and dysphagia. Kidney, it causes urinary retention. It will be very problematic in case of elderly patient who are associated with BPH, benign prostatic hyperplasia. And on the eye, it causes photophobia because of dilatation. There will be blurring of vision. It can precipitate acute congestive glaucoma. Therefore, atropine is contraindicated in persons who are at high risk of glaucoma, especially the acute congestive glaucoma. So let us understand the atropine topic by going through some of the MCQs. So atropine is commonly used as an antidote in case of poisoning caused by which of the following substances? So whether it's cyanide, carbon monoxide or organophosphate or the methanol. So atropine is antidote of choice in case of organophosphate compound poisoning as well as in case of the anticholinesterase overdose, that is the physostigmine overdose. So next question, which of the following is not a typical adverse effect of atropine? So whether atropine causes dry mouth? Yes, it causes dry mouth. Blurred vision? Yes. What about the urinary retention? Yes, it causes. But at therapeutic doses, atropine causes tachycardia, not the bradycardia. So next question is, atropine is administered before anesthesia primarily due to, the reason is whether it is to induce sleep, reduce salivation and secretion, to increase the heart rate or to prevent nausea. So pre-anesthetic use of atropine is to reduce the secretions in the airway. So this is the summary of atropine. It can be used in case of bradycardia condition because it causes tachycardia, pre-anesthetic agent. In case of OP compound poisoning, ophthalmic use for pupillary examination because it causes dilatation of the pupil. GIT, it can be used in case of irritable bowel syndrome as an antispasmodic agent, and also in case of urinary bladder disorders like urge, urinary incontinence, as well as in overactive bladder. Adverse effect, it can cause dry mouth, blurring of vision, tachycardia, urinary retention, constipation, constipation as well as confusion because of the CNS side effects. So if you find this video useful, please do subscribe to our channel I Love Pharmacology for more updates on pharmacology. Thank you.